Hello, everyone. My name is Jonathan Krawchuk, station manager here at Culpeper Media Network, and we are in for a treat today. Welcome to another edition of Community Updates. Joining us today, as you can see on the screen, is Tammy LaGraffe, director of the Free Clinic of Culpeper. First off, Tammy, thank you for joining us this morning.
Thank you so much for having me.
Now, first off, we have a lot to cover, but basically, the Free Clinic of Culpeper over the years has provided a much needed and very valuable service to the citizens of Culpeper for many, many years. I mean, the Free Clinic you're a little bit more than just a nonprofit medical facility. I mean, you provide medical care, prescription medications, but really you're just concerned with the health and well-being of Culpeper in general. Would that be an accurate statement?
Absolutely, yes. So when the Free Clinic first started, it was just a few concerned citizens, basically, who wanted to make sure that people who didn't have insurance in the community could have health care. Then a few years ago, around 2014, the Culpeper Wellness Foundation came and took the Free Clinic under their umbrella. And their mission, of course, is the health and wellness of the community, too. And so we do see it that way. We see it that, in context that we are providing medical care and prescriptions, but we're also providing education to live healthy, eat healthy, keeping people preventatively taking care of themselves so that they can go to work, they can be productive, and it contributes to the whole community. So yes, that is true.
Well, you've talked about a couple things, and we're gonna definitely touch on a few of those things that you just mentioned. But I want to go back a little bit and talk about your. Tell us about the physical location. Tell us about your staff. For those who may not be familiar with the Free Clinic of Culpeper, tell us where you are. Tell us about your staff and basically just kind of what goes on there.
Okay, so we are located at 610 Laurel Street. We are just sort of behind the emergency room of the hospital.
Okay.
And we have a little small building that we love. We have 3 exam rooms. It's very cozy in here. We have a small, very dedicated staff of a front desk person. We have a physician's assistant, Kathy, who everyone loves, and Becca, our clinical care coordinator. And then we have a part-time nurse, Joyce, and myself. That's kind of it. We have a lot of wonderful volunteers, thank goodness, because we couldn't do it without them. And basically, we have a couple other people who come and help us out. We have a pharmacist who contracts with us, and we have some help that comes over from the Department of Social Services a couple times a week.
Now you're a registered nurse yourself, correct?
I am, yes.
So, I mean, one of the things that I've noticed in my multiple visits down to the Free Clinic of Culpeper, it's, obviously you provide medical care, but it really does feel like you're coming into someone's home. That sense of family that you, the staff, the volunteers all have, it's exceptional, to say the least.
I agree. And it had that feel when I came. I just started here last February. And I think that we've tried to continue to grow that because we want people to feel comfortable and welcome here. Sometimes people who are struggling and vulnerable don't always feel like they can advocate for themselves or that they can speak up for themselves. And so we try to start right from them walking in the door to feel at home and comfortable and safe. So I'm glad that's coming across because that's really what we want.
It most certainly is. Every single time I've come there through the years, I've gotten that feeling. The smiles abound. Everyone is just. It really is like you get the sense of family when you come in. I think that makes it a lot easier because a lot of folks that come into the Free Clinic, it may for them be a difficult time. And we were talking a little bit earlier about the patients, but for those who are seeking medical care, without insurance, most likely for their first. I think in general, a lot of these folks that come in seeking medical care are without insurance for the first time. But these patients, can you kind of give us an idea of what qualifies me to be able to receive care at the Free Clinic of Culpeper?
So our patients have to be residents of Culpeper County. They need to be 18 years old, and they need to have absolutely no insurance. They also need to meet some eligibility guidelines on income. So they have to be making 250% of the federal poverty level or below. So we look at tax returns and pay stubs to make sure that that's the case. And the reason for that is we have a licensed pharmacy on site, and we receive a lot of donated medications through companies like RX Partnerships and Direct Relief. And we have to prove to them, we have audits, and we have to prove to them that we are making sure that our patients do qualify under those levels to receive those medications. So we look at all of that when they come in, and then annually we update that in case they've had any changes to their income. A lot of our patients work. We have people who are self-employed or work in the restaurant business, maybe, where they don't get benefits. So yeah, some people think, well, you can't have a job, but you absolutely can be working and just need help with that part.
Well, while we're on this subject, one of the things that I've noticed is the ease at which you allow your patients to find out if they meet these guidelines. I was just on your website, freeclinicofculpeper.org, today, and one of the very first things you see is that I believe there's a button that says, "Am I eligible?" So we mentioned the website. If someone is curious if they are eligible to receive care, obviously we have the website. What other resources would you direct them towards to find out that information?
So they can always call us or stop in, and we will talk to them. And we also have, right on the website, we have an application for becoming a patient, or they can stop in and pick one up. We have both Spanish and English versions of those. And so anytime people have questions, we highly recommend they call us or walk in and talk to us.
All right, and of course, as we mentioned earlier, when they do walk in, you will see exactly what we talk about when we say it's a sense of family when you do come in. Now, Tammy, earlier you were talking about, I think you were describing your building as a small building, but I would say you are small but extremely powerful. The level of service and the breadth of service that you offer is amazing. Can you talk a little bit about some of the things, talk a little bit more about some of the services that you offer to patients when they come in?
So we are lucky in that we receive a lot of support from the Culpeper Medical Center right next door. And so we are able to offer our patients regular family practice visits, but we can send them for lab work, for testing, imaging right next door. We also can send them to specialists through the UVA system, or even outside of the UVA system. We do work with Lions Club to send people for vision exams to a few local people in community. We try to help them get Medicaid if they need Medicaid. We can help with medications that maybe aren't donated. They're a little more expensive through our medication assistance program. We help with nutritional counseling. We have recently put into place some telehealth services so that we can communicate with them at home. We can also connect them with some behavioral health counseling through the telehealth now, through some providers in the community. And also we're doing a little of that nutritional counseling through telehealth as well. So we also, are pretty connected with a lot of community partners. And so we can call people and say, hey, we have somebody here who might need a little more services in this area or that area. So it's very much, we work to meet the needs of the individuals. Wherever they're at, we try to meet them and get what they need.
Well, you make a fantastic point. You're leading into my next topic of discussion. No free clinic is an island. And you mentioned just right there, I think 4 or 5 unique community partnerships that you currently have. And I would say that over the years, you have worked with multiple, countless community organizations or partner with community organizations to basically provide the level of care that you do. It's really incredible.
Mm-hmm. Mm-hmm. We do. We are so lucky because we really, in Culpeper, we have a lot of really good resources. And if we learned nothing else through COVID, it's how much we need each other, right? So we have figured out who we can call when we need anything from food to clothing to transportation. And we have a lot of good services here, from FAMS and Foothills to CSB, emergency services, even Goodwill.
Mm-hmm.
We've even made connections through the minority and veterans farmers for our garden box project that we're working on, and Options, who have had some of their participants come over and help us with that too. So there are so many people in this community, and they have come together really well during COVID, I have to say. And it's just so nice to be able to pick up the phone and call one and say, help me problem solve this, or can you tell me, if you can't help me, who can?
Exactly.
So
Exactly. Yeah, and it's really incredible. If I've said it once, I've said it 5,000 times. One of the main reasons I love this community that we are part of is the people that are in it. You, those you work with, and those who help. I mean, literally, Culpeper will give you the shirt off the back when you need
yeah.
it, and it's something that I absolutely treasure and cherish about this community. Now, Tammy, you were talking about a couple projects, a couple special projects just then, and I kind of want to delve a little bit deeper into that. You mentioned telehealth, which obviously is a big component, I would say, of what you do, considering the COVID circumstance that we're in currently.
Mm-hmm.
One of the things you also mentioned that I want to talk about is a garden box program, because that kind of ties in quite a bit of, well, it ties in community partnerships. It really encompasses a lot of what the Free Clinic stands for. For those who maybe not have seen the posts or the pictures on Facebook, I would welcome them to check you out on Facebook, which I believe is Facebook.com/Free Clinic Culpeper.
Mm-hmm.
You're doing raised garden beds, and you had some pictures posted, but that ties back to what we were talking about, the community partnerships, but also a unique way, I think, of offering nutritional counseling. Tell us a little bit about that program that particular program that you're working on now.
So a few things happened. We had some really overgrown shrubbery out here in front of the building, and we were talking about cutting it back and deciding what to do with the space. And one of our board members said, what about making it useful? And what about some garden beds? We had a few small ones in place out front that Cooperative Extension had been tending to. And even we had some volunteers. I think we had some Girl Scouts at one point who were tending to them. And what we found is people got so excited when vegetables came. Weekly, our Cooperative Extension person, Brenda, would bring lettuce throughout the summer, or some tomatoes or vegetables, and that was snatched right up. And it gives us an opportunity to hand a recipe with it, how to make something healthy, a side dish, or to kind of stay away from canned vegetables and use these if you can. But those vegetables are not inexpensive in the store.
No.
So let's take that space, let's put some vegetables. gardens in there and allow our patients to do that, to take what they wanted. Even people around the neighborhood have come over sometimes and found some cherry tomatoes that they took or something like that. So yeah, so we're very excited about that.
Now, we obviously we talked about the community partnerships. You had somebody drop off some equipment, and you had some compost brought
Yes.
in, which is currently blowing all over the place.
Yes, it's, I'm fighting with every day. Yes.
Again, as we were talking before the program, that's a unique part of your job description.
Yes.
But
Yes.
and you're getting ready to plant those, I think, in just a couple weeks, right? I think you said mid-April.
Yes. The 16th, we're having another event where we're having some of those same community partners come back, minority and veterans farmers of Piedmont. Um, some people from Whole Heart Farms are the people who helped us get the boxes together. They make these beautiful cedar boxes. They smell amazing. And options and a lot of our volunteers. We have some, like I said, excellent volunteers who are so loyal and dedicated to us. So we'll be getting those planted hopefully here in a couple of weeks. So
Well, I'm excited, and maybe I have to come down and take a couple pictures, and
yes.
maybe bring a recipe card myself. How about that? Now, when we were talking about some of the other programs, again, we mentioned the telehealth. If But one of the other things that I had on my list were the fit scripts, which I'm not as familiar with.
So we have under the Culpeper Wellness Foundation umbrella, Powell Wellness is one of our sort of sister organizations. And they have a program to do some medical fitness programs. So sometimes if we have an individual who's maybe struggling with getting some exercise or knowing how to do exercise or having a little more of a structure to their exercise so that maybe their blood sugar comes down or their blood pressure comes down, we can send them over there. And they do a program, and I think it's like 8 weeks where they basically work right with a trainer and get some routines in place, hopefully. So it's a great program.
Again, another fantastic community partnership.
Yes,
Tammy, I mean,
excellent.
you're doing a great job. I'm telling you, it's amazing. So again, there's a lot going on. Still more to talk about. One of the programs that you specifically mentioned in our discussions before the program, and one in which there's a lot of work being done, is a diabetes outcome program. Tell me a little bit more about that.
So we see a lot of diabetes, as pretty much everybody does in our society right now. The rates are high, and unfortunately, when people have high blood pressure and diabetes and high cholesterol, that's a really bad trifecta to be dealing with. And so we're trying to break that cycle a little bit for people. And the other thing that we know is that people with diabetes are very susceptible to all kinds of things, like COVID, for example.
Mhm.
Our diabetes population gets hit really hard by COVID, some other infections, viruses, everything. They tend to have an immune system that gets hit hard. So we are trying to start with that group in particular. And we picked a group of patients that we could work with very intensively over a year, the course of a year, and we have them coming in and meeting with the nutritionist. We have them meeting with our pharmacists to talk about med compliance and answer questions. Our nurse, Becca, is doing, she has a diabetes certification, so she's been working really hard to do education on testing and how to monitor your blood sugars. And again, we're connecting with Powell for fit scripts for them. And we are going to have our nutritionist, Brenda, taking people out to the store and grocery shopping with them to show them how to choose healthy while you're there. So we also are incorporating some blood pressure programs within that. And we're hoping that by the end of it, we can show that people's blood sugar is coming down and they're picking up some healthier habits. So we just started it. So we're fingers crossed. to keep it going and keeping everybody involved. So
Well, you know, Tammy, as we have this discussion today, it is we talked about the amazing work that you do. I think another word to attribute to the Free Clinic of Culpeper is your unique approach. I mean, here we are. You talked about the raised garden beds and talking about the diabetes outcome program, actually shopping with a patient and giving them. It seems to me that you are really unique in the way you approach care for Culpeper, and I think that is, well, not only is it unique, but it's probably extremely helpful.
yeah, we try to make it so that it's less medical, a little more fun, a little more sort of everyday lifestyle, so that it doesn't feel so much like it's a chore to be healthy, that it can kind of come a little more natural and feel a little more fun rather than just, oh God, I got to give something up, or I've got to do more, so.
Well, Tammy, you know, you mentioned earlier that you started as a director of the free clinic last February.
Mhm.
Talk about timing, right?
Yeah.
Because it wasn't a month later when COVID really hit, and I mean that really has just changed the game. You really, I would assume that because you know over the course of COVID, so many people have been affected. Obviously, their health has been impacted, but also a lot of
Mhm.
folks they've lost their jobs, their income has changed, and Free Clinic has really, I would say, stepped up even more so during that time. And here we are, and you as the brand new director.
Yeah, I've had a lot to learn, but luckily the team here was great, and they really have everything under control, and so we have really had to change a lot. Um, Probably was easier on me than them because I didn't know how it was done before. So basically, we went from not allowing people to come in and only and limiting all of our volunteers to slowly building back up to a little bit more normalization, but doing COVID testing in the parking lot and trying to make sure people are getting vaccinated. It's really been a huge focus this year, obviously, for everyone. So
Absolutely, and you guys, the Free Clinic has been doing a tremendous job. Now, Tammy, as we sit here and we have this discussion, and I learn even more about the Free Clinic in Culpeper, what you do in a unique fashion for the health of Culpeper's community, I want to help. And there are a lot of ways in which I can help. In fact, there are two events in particular coming up that we want to make sure we mention because if I am correct, and it seldom happens, I'm assuming that that you're going to need help, and you. I'm sorry. I'm so excited about all the stuff you're doing that I'm literally falling over my own tongue. Two events: the Give Local Piedmont is coming up, and
yeah,
Oyster Fest. Now, these are two big fundraisers for you, correct?
they are. So a huge part of our budget comes from donations. We do get some state funding based on our numbers of patients that we see, but the majority of our funding comes from donations. And a lot of that comes from just private donations. So Give Local Piedmont, that's coming up, I think May, I can't remember the date, isn't that awful? Um,
I want to say it's May 4th.
I want to say right around there, yes. Um, People can go to their website and make donations that way. And honestly, everything helps from, $1 on up. We are thrilled to have any amount. Um, and then in the fall, normally we have the first Saturday in October, we have our Oyster Fest. And of course, last year, like everyone's events, it had to be postponed. We
Mhm.
called it postponed. But we will be holding it this year. And it is out at Rock Hill Farms. And it'll be October, I think, 2nd. It's the first Saturday, so I think it's October 2nd, and it will be from 4 to 8 in the evening, and we have oysters every which way you can imagine them cooked. There's a pig roast. There will be all kinds of delicious food and music, and it is a huge, huge fundraiser for us. And so we will be promoting that greatly. And if people want to find out more, they can definitely call us or visit our websites on that.
Well, barbecue, oysters, music, and all for a great cause. You're going to go ahead
Mhm.
and pencil me in for that one. Actually,
Yeah.
no, you can go ahead and ink me in for that one. I would
Oh,
appreciate it.
great. Thank you.
So, if folks want some information regarding that, obviously they can email freeclinic@culpepperwellness.org. They can reach out to the website, and of course, they can
Hmm.
call you as well. And we've talked a lot about volunteers, and they are the lifeblood, obviously, of every nonprofit organization.
Hmm.
If I want to help, I mean, obviously you take donations. I mean, can I just call you and figure out how to write you a check? But I can also volunteer with you, right?
Yes, both of those things. Always, anyone who wants to call me and ask me questions about anything, I am here. And, sometimes people want to come and visit us, and that's okay too, if they want to see what happens here, what it looks like. Um, but definitely, we always can use volunteers, and we can use volunteers who want to just help file to volunteers in the medical profession or pharmacists or nurse practitioners. Sometimes we get students who need to fulfill some clinical hours. So anyone who wants to volunteer, please contact me and we can talk about that some more. We are thrilled to have volunteers.
Well, with Tammy, we have talked quite a bit this morning about the Free Clinic of Culpeper, and deservedly so. As you mentioned, you might have a smaller building. I think it's beautiful, but the amazing work that you, your staff, and the volunteers do with the Free Clinic of Culpeper is quite uh, astounding. Is the understatement of the century. I thank you and your staff and the volunteers, everybody who goes through that office for what you do. You do truly provide a critical service to the community of Culpeper, and I, for one, thank you. Now, Tammy,
Thank you.
you're welcome. But before we head out, is there anything maybe that we forgot to mention, or that we want to make sure that we touch on a little bit more before we wrap up today?
I cannot think of anything else except to say that, again, I think you said it well when you said that the free clinic is not an island. And I think that the support that we have received from all of the other resources in Culpeper this year, especially the hospital and the health department. I have to say a lot about the health department. I've had them on speed dial this year and they have been amazing. Um, all of them have been great support to us and our patients. And I can't say enough about the volunteers and team here. Like you said, they are amazing and they have really stepped up and been here every day and just so proud of to be part of this program. So thank you so much for allowing me to gush about them today.
It's our pleasure, and every opportunity we have available, we will most certainly give the Free Clinic of Culpeper the spotlight it truly deserves. Hopefully, sometime soon we'll be able to come down and physically visit you. Maybe do another interview
Mhm.
like this. I definitely need to see. I definitely need to see those vegetables come up, and
I
I need to.
know.
I need to work on my gardening skills. And what a great place to get some work done. Well, Tammy, again, thank you so much for what you do and for taking the time to talk with me this morning. I really appreciate it. And I know the Culpeper community appreciates you and the work that you do every day. Thank you so much.
Thank you so much.
Well, ladies and gentlemen, again, we've had a great conversation with Tammy LaGraffe, the director of the Free Clinic of Culpeper. You can see on your screen ways to contact and get more information. If you're curious, if you're eligible to receive medical care from the Free Clinic of Culpeper, there are some eligibility requirements, but it is very easy to find out if you meet those. You can log on to freeclinicofculpeper.org or you can call them at 829-5032. You can also find them on Facebook, and that's facebook.freeclinic.org. Culpeper. I advise you to find out ways not only that you can receive the medical care you deserve, but also how you can help others receive the medical care they deserve as well. To volunteer, to donate, or just learn more information, please reach out to the resource of our community that is the Free Clinic of Culpeper. Well, again, I want to thank Tammy LaGraffe, Director of Free Clinic of Culpeper, and also thank you for tuning in. Again, reach out to our free clinic and see how you can help. Until we see you around Culpeper, you have yourselves a great day. And of course, a better tomorrow.